case study 5 was about special populations. It was for individual, for group, for couples, and families. They gave us a scenario where there was a 56-year-old man who called on the phone. He was having problems. He said about a breakup, but the it was noticed that he was apprehensive. He was just seemed as if he was interviewing the counselor, and he was not forthcoming with lots of information. So my tentative assessment and plan was the subjective would be the problems with ending the relationship. The next part would be the underlying emotions, and that would be the apprehensiveness, the interviewing of the therapist, being overly cautious, meticulous, and suspicious. My assessment was this is a 56-year-old male. He called to the office for an urgent appointment. During the phone appointment, a lot of his emotions began to come to the surface. And due to the gravity of the situation, an appointment was given for him for later that day, so that we could continue with that. The plan was to ensure the client understands that this is a safe and non-judgmental place. Need to assess for a suicidal ideation by asking if he has a plan or if he has told anyone he has a plan. Need to be supportive by being genuine, honest, and showing unconditional regard. I need to ascertain if this issue is related to ethnicity, environmental, or if it is a religious factor. Okay, the next special population would be the group. Um, we found out he has a history of untreated PTSD, post traumatic stress disorder. Objective, he was defensive, he was suspicious. The assessment was untreated PTSD, paranoia, and defensiveness. We need to work on his rapport, on the rapport building with the client. We need to assess the client for substance and alcohol abuse. We need to carefully examine what the client says about their experienced trauma, assess the client for depression, and assess the client's insight to see if he's thinking clearly. Okay, the next population is group. And he needs to subjective understands the purpose of group. Objectively, client crying uncontrollably, inability to share due to distrust of others. The assessment, normalize and validate the client's crying. Encourage the client to talk about the reasons for crying. If the client is not comfortable doing this, then provide a safe place for him to do so. And this client might benefit from individual therapy as opposed to group therapy. The plan would be to stop the group for now, to work individually with the client on the trauma caused by PTSD, and work on him with trust issues. The next special population was couples, family. The subjective was client and girlfriend came to the office unannounced. He just said about himself, he didn't mention the girlfriend. They exchanged much dialogue about their impending breakup. Then he shares a small detail about his PTSD. The objective girlfriend is the more verbal of the pair. The client is overwrought when talking about the breakup. Assessment, unannounced girlfriend shows up for the appointment. The client's revelation into PTSD may be one of the reasons for the impending separation. Other information brought forth was the dislike of the client by her family. So the plan is to investigate the PTSD further for more clarity and then figure out how to formulate a treatment that will be viable for him. Next, we need to determine if they want individual or couples therapy, because I would most likely refer the lady out for individual therapy and keep him as the client since he was first there. Explore the dynamics of the girlfriend's family with respect to how the client is treated and how that makes him feel. And that was my assessment of the scenario. I used Jerry Miller and a handout I had from another class on PTSD. So thank you.